In this video, I'll talk about low thyroid symptoms. I will discuss the 8 most common hypothyroidism symptoms in females that you should look for. I will also briefly discuss what tests can you do to check your thyroid function, what is considered a normal thyroid hormone range, and what are some of the causes of low thyroid function. By the way, if you're new to my YouTube channel, my name is Greta. I'm a nutritionist and a holistic health coach. If you haven't yet, subscribe to my YouTube channel and click the notification bell to not miss out any of my future videos. The thyroid gland is a small butterfly-shaped gland in the neck. One of its main functions is to produce thyroid hormones, including T3 and T4, that help to regulate the body's metabolism. Metabolism can be defined as the chemical processes that occur within a living organism in order to maintain life. So, as you can imagine, the thyroid gland is very important. Many of the body's functions slow down when the thyroid does not produce enough of these hormones. You can either have hyperthyroidism or hypothyroidism. Hypo means not enough of thyroid hormones, and hyper means too much of thyroid hormones. If there is a problem with this gland, you might get a very fast or a very slow metabolism. In both cases, it is not a healthy state. We need the middle ground. With hormonal imbalances, it is quite common to first get into the hyper state, then burn out and turn into a hypo state. How do you know if you have low thyroid? Well, the only accurate way of finding out whether you have a thyroid problem is to have a thyroid function test, where a sample of blood is tested to measure your hormone levels. The problem with blood tests is that most doctors will only check for something called thyroid stimulating hormone, TSH, which doesn't give a full picture of your thyroid function. Testing your free T3, free T4, and thyroid antibodies is also important. Then, in addition, the interpretation of this test is also incorrect most of the time. Most doctors would consider TSH levels below 5 or even 10 as normal, while the newer guidelines consider anybody with TSH of more than 3 as low thyroid. This leaves most people with low thyroid function undiagnosed and untreated. Normal TSH levels should be between 0.5 and 3 milliunits per liter. Now, before you get tested for hypothyroidism, here are the specific low thyroid symptoms that you should look for. If you have any of these, definitely get checked up by a doctor. The first low thyroid symptom, excessive tiredness. Even after long hours of sleep, you simply don't feel rested enough. As mentioned earlier, thyroid gland regulates your metabolism. So if it's not working properly, you might have this constant lack of energy. The second low thyroid symptom, unexpected weight gain and difficulty losing weight. You might start gaining weight all over your body. Your basal metabolic rate decreases and you are more likely to store fat. Even if you don't increase your caloric intake, you can gain weight because of this hormonal imbalance and shift in your metabolism. So this shows again how important are hormones when it comes to weight gain and weight loss. The third low thyroid symptom is often feeling cold. It's an indication of slow metabolism. Your decreased BMR or basal metabolic rate causes reduced production of heat. If you're that person who often feels cold and has cold feet or hands, it could be an indication of low thyroid function. The fourth low thyroid symptom is loss of muscle or muscle atrophy. Due to low thyroid function, your body might start switching into a catabolic state, meaning it is breaking down protein in your body and making energy from it. This could cause muscle atrophy and feeling of weakness in your muscles. Muscle cramps are also common between people with low thyroid function. You can also get loose skin under your chin. The fifth low thyroid symptom is hair loss. With low thyroid, you will have difficulty absorbing protein. This could cause symptoms such as thinning of your hair. You might even start losing your hair. You may also notice hair loss in the thinnest part of your eyebrows. Hair is very sensitive to low thyroid. It prevents hair follicles from regenerating. So if you notice unexpected or abnormal hair loss, it could indicate that you have low thyroid function. The sixth low thyroid symptom is itchy and dry skin. Low thyroid function affects skin cell regeneration. This could result in dry, flaky skin. The 7th low thyroid symptom is feeling depressed. Hypothyroidism is closely linked with anxiety and depression. Also, if we think about the symptoms of depression and hypothyroidism, these are very similar. Low energy, low mood, feeling ill. If you're feeling depressed, it would be a good idea to check your thyroid function. The 8th low thyroid symptom is poor memory and focus. Many people with low thyroid function report having poor memory and focus, brain fog, and being slow. Low thyroid function causes similar effects to those of dementia. In fact, people with hypothyroidism have an increased risk of developing dementia later on. If you observe decreased cognitive function, you should get checked up by your doctor and see if your thyroid is functioning properly. It's important to take action early. These were the symptoms of low thyroid. Now, what causes low thyroid function? T4 is an inactive thyroid hormone. It must be converted to T3 before the body can use it. Most of this conversion, around 80%, happens in the liver. Some of this conversion also happens in our gut. If your liver is not functioning properly, this can reduce your body's ability to convert T4 to T3. Then we have to look at iodine. Iodine is involved in this conversion. It could also be that you're not eating enough iodine. Low thyroid function could also be originating from poorly functioning gallbladder. That's a gland located next to the liver. It produces bile needed for fat digestion. This bile is also involved in concentrating iodine needed for T4 to T3 conversion. Another very common cause of low thyroid function is too much estrogen. A lot of women get hypothyroidism after pregnancy. This spike of estrogen is likely to cause low thyroid function because estrogen hormone competes for the thyroid receptors and it can block them. High estrogen can also interfere with the conversion of T4 to T3 in the liver. Women are 8 times more likely to have low thyroid function. It could be because of this high estrogen. If the problem started after pregnancy, then most likely it is caused by too much estrogen. It is well documented that pregnancy puts stress on the thyroid gland, as the demand for thyroid hormone increases after getting pregnant. In addition, giving birth makes you more susceptible for autoimmune thyroid disease called Hashimoto's disease. Hashimoto's disease is an autoimmune disorder that can cause hypothyroidism or underactive thyroid. With this disease, your immune system attacks your thyroid. The thyroid becomes damaged and can't make enough thyroid hormones. If you have Hashimoto's disease, your major focus should be removing all the possible triggers, things like gluten and dairy, and staying away from any type of harmful chemicals. Now, is there anything else that can disrupt your thyroid function? Yes. Hormones are our body's way of communication. Glands make these hormones. Glands are very sensitive to the environment. Things like stress, your diet, sleep, and endocrine disruptors. Things like toxins and other chemicals in the food, water, and environment. All the pesticides, herbicides, heavy metals, harmful food additives, all this has a huge impact on your glands. Some of these chemicals can disrupt your glands because they act in a similar way as our hormones. Some of these chemicals mimic our hormones. There are endless possibilities of what could have caused your low thyroid function. The best approach for you, if you found that you have some of these low thyroid symptoms, is to get tested, get a confirmation. Your doctor will prescribe you a suitable treatment, and then try to eliminate as many of the possible causes. You will need to use a holistic approach that focuses on eliminating certain foods, reducing stress, improving the quality of your sleep, improving your gut's health, detoxifying your liver, balancing out your hormones, and avoiding hormone disruptors. If you need help and support for managing your condition, I have an online coaching program where I could guide you through this whole complex process. It's a fully personalized health coaching program with weekly meal plans. You can find the link to learn more in the description of this video. If you found this video useful, don't forget to like it and subscribe to my YouTube channel. Thanks so much for watching, and I hope to see you in the next video.